Substance use really affects everybody.
A new medical team is bringing addiction services to remote First Nation communities across Manitoba, where access to resources are limited. The pilot project is called the Manitoba Mobile Addiction Team to Increase Community Capacity and Access, which is run by Four Arrows Regional Health Authority. The hope is to create services for healthcare professionals to manage the treatment of substance use in remote communities.
We're really looking to see whether or not we can provide service to these remote communities in a novel way so that people can have access to service even if they're not located in Winnipeg or Thompson or Brandon.
Dr. Erin Knight is the medical director of the pilot project. She said it was important to hire people who have experience with substance abuse to share their knowledge.
We are really trying to engage with people who are using or have used drugs and alcohol within the communities to make sure that the services are really kind of meeting their needs.
Should be something that's desperately needed in our community.
Youth advocate Daryl Schwader from Shamattawa First Nation, about 750 kilometers northeast of Winnipeg, says addictions in the community are the worst he's ever seen in his lifetime. Schwader says it's a mistake to bring the services like this project into remote communities, citing the importance of bringing those with addictions out of the community they are in and brought to a different location. At this time, Schwader estimates over 50% of the people in Shamattawa are users of opioids.
The people that really do get hurt in this is the children. They're the ones who are suffering due to the choices that families make. They're being left behind. They're being neglected. They fall into the system. They get taken away from their families.
Back in May of 2021, Shamattawa First Nation declared a state of emergency due to a suicide crisis. Schwader says the pandemic and sheer isolation from society were two major reasons for the crisis and still impact residents to this day. He says nothing will change and will only worsen if the provincial and federal governments don't provide long-term services to communities like Shamattawa.
It's sad, that we're not being taken seriously.
Dr. Knight says she understands the concerns from people within remote communities across the province and is working hard to get services to these communities as soon as possible.
Absolutely. There needs to be somebody in community being able to support people affected by substance use long-term. And what we're hoping is that by providing that support through this specialized team, that we can really build that capacity in each community.
In Winnipeg, Alex Karpa, City News.